Hi everyone, Kevin McDermott here. I'm over in Guam, and yes, one of the as we just celebrated Fourth of July, I reflect in Guam, Fourth of July isn't as popular of a day. More popular day is what we call Liberation Day, which is the 21st of July. It's the day when the Marines came and liberated Guam from the Japanese, and so for us here, that's a more pressing Independence Day. And this year is the 80th anniversary year, where there's going to be a big parade, celebrations. And I think it's our first celebration since COVID. So the last couple of years has been unsuccessful due to a typhoon and COVID. So it's a good year to celebrate.
And that's July 21st, right?
July 21st, which is a Sunday this year, so, which happens. And then I'm going to share my screen. I think it's there. Is it able to be seen?
Perfect.
Excellent. And so I'm here to talk about mental health availability in Guam. Uh, a little bit more about me. I am the medical director of the Guam CBOC, which is our community-based outpatient clinic for the VA in Guam. I'm also in charge of Saipan and the Marianas Islands. The one of my recurrent discussions is about what kind of makes Guam more challenging or unique to practice medicine in other places compared to other places. And so this topic is one that commonly comes up. So we'll talk about what's available in Guam and kind of some of our approaches for mental health care in Guam. Ah, one sec. There we go. So we have a couple of objectives. We're going to review some regional challenges. One of the common things in Guam is not enough people probably know about some of the difficulties of being in Guam. And we'll go over some fun facts about Guam along the way. We'll identify the options for mental health care in Guam and what that means for us, and then kind of understand different processes for some mental health patients that can come our way. One of the important things I always have discussions with, but I do often discuss things more with mainland people in DC, is about where Guam is, what Micronesia is, and where are we. I know this group's a little bit more educated in that, but just so we're on the same playing field. We are in Guam, which is in the center of this little map here. I like to superimpose the United States upon it, which is actually a perspective that's accurate for size there. I often describe to my colleagues in Oahu, we're about 1 to 2 Americas away. The other way I describe it is a flight from Guam to Oahu is the same distance as Oahu to Houston. And so when we're talking about our neighbors, think of your neighbor as being in Houston as your next door neighbor, which is a tough place to think about sometimes. Guam is a regional hub for Micronesia. And while we say Micronesia, and often Micronesia is a little bit of a loose term to describe the Federated States of Micronesia, we have other components here. And so I have our flags on the right-hand side. So right north of Guam is the Commonwealth of Northern Marianas, often abbreviated as just Saipan. South and a little bit east is Palau, which is a protectorate state. People in Palau are able and allowed to move and live in Guam forever, but are not considered U.S. citizens. We have the Federated States of Micronesia. It's that 4-star map there, considering of the 4 states, Yap, Chuuk, Ponape, and Kosrae. And then, of course, we have the Marshall Islands in between Guam and Hawaii. All these people can kind of migrate to and from Guam, although we often get more migration people from Palau and FSM. So let's talk about Guam and about some fun facts in Guam. So Guam is about 30 miles from top to bottom, about 10 miles wide. The closest sized island in Hawaii would be Molokai, which is about the same size. However, we have a little bit of a different population size. We have about 175,000 people that live in Guam. The people of Guam are called Chamorro. They're the native population. They have their own local language, also called Chamorro. The people here are, while we're a territory, are U.S. citizens, the same amount of rights as any other person in the United States. 25% of the island is composed of military bases. And we divide up our island in what we call villages, not cities or towns. We have 17 villages, with the capital being Hagatnya, which is the star right there. That's where it's at. Most of the population lives in the northern half, kind of where that star is in north, is where most people live. The south is fairly rural. It has kind of a cultural and other divide between them. Now going back to a little more medical care, and this picture actually shows where those military bases are. The military bases are divided up and amongst mostly Navy and Air Force. The Air Force base in the top, the Navy controls most of the stuff south of that. We have a new Marine Corps base there in the northeast called Finnegayan, also called Camp Gloss. And there's other little patches throughout. We have 3 main hospitals in Guam. So we have the Naval Hospital, which is where that blue star is. It's actually where I'm currently located right now. We have the Red Star, which is the public hospital called GMH, Guam Memorial Hospital Authority. And we have a private hospital, the Green Star, Guam Regional Medical City, all kind of located in the same cluster. And you'll notice that actually most services are within a small kind of cluster, a little north, a little central and stuff of Guam. And our clinics are, we have a lot of kind of standalone clinics, but our largest clinics are public health, the SDA clinic, Seventh-day Adventist, AMC, American Medical Center, FHP, IHP, and then of course the VA. When I say large though, just for some perspective, these clinics are usually, the VA clinic, for example, is a 7-physician clinic. These groups are not necessarily as large as they might be on mainland places. Okay, some mental health statistics. We gather most of our mental health statistics from public health and the Guam Behavioral Health Department themselves. In regard, our surveys are not as great as or as in depth as some other places. So kind of focusing on some of the best evidence we have for mental health statistics would be into the suicide rates of Guam and maybe some of the little differences that come about. So our suicide rate when age-based population based is about 21.9 per 100,000 in 2022. In the same year in the United States, the rate was about 14.9, so quite a bit higher. When we look at where suicides are happening, they're mostly happening at home. One of the main differences that compares with mainland is that the most common method is hanging, about 82%. There's been a lot of discussion about things like gun reforms. When we talk about gun-related suicides, that's actually about 10% of our deaths, so not necessarily a tremendous amount. When we look at some other comorbidities, we talk about drug use, which is about 32% of suicides associated with. Only about 14% had prior documented mental health illness, and only about 11% had prior attempts occurring. As some fun, we do have our own crisis hotline, which is listed there. The National Suicide Hotline actually works in Guam. And since we converted to a 10-digit phone number, other national numbers exist. As another fun fact, until a couple of years ago, you didn't have to use area codes for Guam. It was just the same number. We used a traditional just 7-digit number. So we converted over, and now we have some of these other things available. We talked about the medical groups. Let's kind of a little more focus in on just general mental health groups. I divide these into 2 kind of main areas: mental health institutions and then more cultural options. So for the mental health institutions, we have some pictures of them on the left-hand side. We have the main one, the public one, the Guam Behavioral Health and Wellness Center, which is associated with the public hospital, GMH. I'll talk more about it in a minute. The military is our big other option. You have in the middle there on the left, you have a picture of the Naval Hospital. Although they do have also mental health services in other parts. And then the VA has the other next largest, and that's the clinic I'm currently sitting in on the bottom left-hand corner. The community-based outpatient clinic has a fairly large mental health section. Something to keep in mind, though, and that's one of the cultural aspects, is there are additional options which probably get an equal amount usage for mental health services in Guam. Religious options are pretty popular. So Guam is about 75% practicing Catholic. So pastoral services, chaplain services are pretty common. Down the right-hand corner is a Sanitary State Church. It's actually within walking distance of my house. In general, local leaders are pretty common to go to for mental health issues. Very kind of tight-knit communities in our various villages. As mentioned, we have 17 different villages. We have 17 mayors. We also have senators in Guam. There's 15 senators that people avail themselves to for all services, which includes mental health. A common local option is what we call the Surhanus. These are the local traditional healers. A colloquial, although not always a nice term, is witch doctors are also a term used to describe them. They often are useful for and used for mental health as well as alternative health medical options. In talking about services, and before I go through here and kind of things to keep in mind, one of the reasons why I kind of focused on the different groups is that Guam does not have a ton of medical services available. And so when thinking about patients, always being aware of what services they have or can have access to allows them to more opportunities. So as just another example, at Guam, we have the highest rate of enrollment in the military. Somewhere around 25% of all adults have been in the military and may have access to the VA or military options. So when you're trying to go through and assess your patients and their care, try to keep that in mind. People are seen throughout the island for various reasons. So for Guam Behavioral Health and Wellness Center, this is the only inpatient services for mental health on island. They are 24/7 service where they can do walk-ins, intakes, and assessments. So any ambulance or any kind of ER transfer goes to Guam Behavioral Health. While the Naval Hospital may have mental health services, they don't have inpatient mental health. Due to some issues, the Guam Behavioral Health is no longer joint commission, and due to staffing among some facility issues, their long-term options have been severely decreased. So let's focus on some things they can do. So when we say inpatient admission for adults and children, this is 3 to 7 day programs for usually suicide and crisis. And subsequently, they have a crisis stabilization option. They do medically assisted detoxification. It's the only place on island that does medication detox for any substance abuse. And they have the most outpatient services, which includes in-clinic and teleservices for cognitive behavioral therapy or CBT, individual therapy, family therapy, general counseling, various groups, and psychiatric services for medication management in general. To date, there are no psychiatrists working at Guam Behavioral Health. They have nurse practitioners and they do tele-psychiatry, but staffing issues has made that sometimes a little more challenging. They do also provide some community programs that got ramped up because of COVID. And so as alluded to earlier, their suicide prevention program and mobile crisis interventions are helpful. Due to the kind of loss of their residential program within the building itself, they do a lot more home-based residential and treatment options. And so they have counselors and social workers that go to homes. They've also been working with residential placement options. So this goes to places like the Lottie Treatment Center, which I'll talk about in just a second. And kind of the picture in the bottom corner are some houses that we've rented out through GURA, the Guam Urban, acronyms are tough, one of our programs here to help out with housing. They also are the people that provide for Department of Corrections. So one of the nurse practitioners goes there intermittently for services at DOC. We have 4 beds that are contracted at the Lottie Treatment Center for children. So for mental health cases, specifically for pediatrics, get sent there, and then services get rendered through this other group. There are 10 residential beds in the community that try to address the long-term care needs, but otherwise there aren't necessarily long-term care options for mental health in Guam. Military. The military is divided up into kind of 4 sections. The U.S. Naval Hospital, which is the first picture there. It's the inside of the hospital. You have Anderson Air Force Base, and that's where you see the 36 Medical Group at the top. Fleet and Family Services is another military option. And then there's a lot of ongoing operational options in Guam with various ships, and they have their own services. So kind of break them down a little bit. U.S. Naval Hospital, it's due to their own staffing issues, they can only treat active duty and family members. As mentioned, it's a outpatient services. So they do adult and pediatric individual therapy and psychiatry. They're the only group on island that actually has a child psychiatrist available to them. They can do psychological testing. SARP is one of their alcohol detoxification programs. They do group therapy. They have, by requirements, on-duty mental health 24/7. But for inpatient services, they would get deferred to Guam Behavioral Health if it comes up. They can do long-acting injectable medications, and they just started their own crisis stabilization unit to help out with suicidal ideation and people in crisis Monday through Friday from 08 to 1400. To kind of also review services on island, there is no ECT on island. There is a group that does TMS on island, just not with the military. Outpatient detox can't be done in the military. Methadone also cannot be done. Outside of Guam Behavioral Health, there's no source for Suboxone, just for the reference. So Suboxone therapies would have to either get mailed in or kind of be managed in an interesting way. Anderson Air Force Base.
Oh. Sorry, Dr. Weir just chatted. He points out mental health also provides rape crisis services and follow-up mental health services, a 24/7 service, which is good. And he also expressed that he wished that they had the rights of other U.S. citizens.
Yes. We might call this a unfunded mandate sometimes. On paper, we have the rights, but in practicality, that may not always be what is occurring. But yes. For Anderson Air Force Base, while part of the military is also somewhat separate, in the north there, they have a psychologist that does active duty only, and any family members get put either to Naval Hospital or out in network. Fleet and Family is a national military program for active duty that is a lot of ways mainly purpose for safety checks in the community. But they can also do marital counseling. And then military operations, as alluded to, is a bunch of ships that come in, have services, but it's limited to just the people on those ships and cannot be done beyond that. The VA, this is where I work. And so what are some options that we have and what services can be provided here? As mentioned, somewhere, when we look at numbers, we think that in Guam, there's somewhere around 28,000 people who had been in the military at some point in time. Whether or not they're registered for the VA is a different question, but asking these questions can be helpful. So obviously the VA serves only veterans, and I think obviously it's only adult patients as well, but we have in-person video and phone options for this. So in the clinic, we have two psychologists, we have therapy options, therapists, we have two psychiatrists and a nurse practitioner. We do daily groups, psychological testing. We have a few nurses that do case management, injections. We have a couple of homeless programs that are in place that also help with further case management. We also have what's called the Vet Center. This is another national program that's also kind of commented as a readjustment counseling. The original purpose is for people who are leaving active duty to get readjusted into civilian life, but their services don't end immediately afterwards. They can continue essentially forever. They also provide individual and group counseling, family counseling, bereavement counseling, and they also have their own case manager programs and assisting with kind of transportation of people. Tele services are pretty big in the VA and probably one of the better tele options in Guam. And so because of this, we have additional services from national VA programs with some time zone difficulties. But we have our own national substance abuse programs, other group options, psychological testings, geriatric psych, and then also, which comes up not infrequently, is arranging off-island services, such as getting people to Hawaii or elsewhere for potentially long-term inpatient programs. One of our popular ones ends up being for PTSD, as an example. So, community options. These are the kind of the ones mentioned were just the groups. So let's talk about kind of the rest of things that exist, the kind of one-off or otherwise options in Guam. There is the Lighthouse, which is our substance recovery program. There are a couple of psychologists, Dr. Lighthouse and Dr. Root, that see people. However, sometimes access is challenging. As an example, I believe when talking just last week, Dr. Lighthouser's next availability is in November, so books out about 4 months. To answer the question about hospice services on Guam, we have no inpatient hospice. There are 2 companies that do home hospice, and that is the extent of hospice. To also kind of piggyback on a question that goes with that is long-term care options. There is one for-profit, cash-based long-term care facility in Guam. There is a 30-day skilled nursing facility associated with Guam Memorial Hospital. Outside that, there are also not any long-term care options in Guam. And people who can't are sometimes stuck admitted into the hospital. As just an example, one of my patients who is now homeless and has no other options has been at the Naval Hospital for a year. He celebrated his anniversary this last year. There's a person at GMH who's been there for 3 years. So sometimes people are stuck for long periods of time in situations. For psychiatry, there's one psychiatrist outpatient, Dr. Bellis. He's been trying to retire for quite a while in Guam, but he still sees patients, but not taking any new patients. The SDA clinic, as mentioned, has a telepsychiatry program. Those 2 other clinics, IHP and AMC, do have counseling options. And then the Department of Education and the Judiciary program have their own counseling and placement options. However, Department of Education struggles with staffing and plans for a lot of their people. Oh, and then I love graphs as well. So in the pictures here, we have the population density of Guam, kind of the review. As discussed, most of the population is kind of in the north. That's where the darker greens are. In essence, most people live in Dededo and Tumon, and kind of this like strip right here. And as you can see, if you remember the previous stars were, almost all medical services kind of exist in this single circle here. Going down south, going up north, sometimes it gets harder. But most services exist kind of in this small grouping here. Okay. With that in mind, I want to kind of go through a case study of how an approach can be to medicine in Guam, and potentially some of the irregularities we can kind of discuss. And feel free to have comments and stuff and ask questions in here. This is a real case of mine from last month. This is a patient that came to see me personally, or well, I ended up seeing personally. So we have a 24-year-old male who presents via police for a walk-in clinic appointment. His mother's accompanying, and she reports that he has been in the police station for the last 3 days after being found walking in the street and uncooperative to commands. The mother states that he had been confused recently prior to this happening. He does not have a history of substance use. While on active duty, because he came to the VA clinic, so he had been active duty before, he was prescribed Lexapro for depression, but no other diagnoses. He has no family history of mental health disorders. He lives with his mother since leaving active duty about a year ago, and he has no significant military history of other trauma or events. And so for me, this isn't an unusual situation. In my clinic, for example, we average somewhere around 30 or so walk-in patients a day for services. This person, in an interesting scenario, had been just placed in a holding in the police jail for 3 days before he was released. No one from mental health had seen him, and he was not sent to Beaver Health for evaluation. On exam, his vital signs are very normal. He is alert and oriented times 0. He cannot tell me anything about himself. He has very pressured tangential speech and undirectable in conversation. During the encounter, he has very inappropriate comments and conversations, very lewd and vaguely threatening. He is in a wheelchair. He's tapping the ground with his foot. He is swiveling around the room, looking at things that are not there throughout the interview and kind of being somewhat incoherent. In an interesting comment as well, his mom was unfazed by this. She's just sitting there, seemingly not very concerned, and per her, this is not unusual, and this is what she's referring to by he's been a little confused lately. On exam, though, his eyes are normal, his mouth is normal, there's no mouth lesions, no head lesions. Heart and lungs are very normal. He is in a sitting position and is not able to be coerced to be in a different position than his chair. However, he does have tenderness on his left lower ribs. There is some bruising, some ecchymosis there. As he's sitting there, he is kind of clutching his left arm. He doesn't really move too much, but he does use his right arm to kind of move around and get his point across sometimes when talking. The next slide reviews kind of what we're going to do next for him. But does anyone in the group have any questions or at least initial thoughts on his scenario? I do enjoy the power of silence as well, and so I'm not afraid of it per se.
I'm not seeing any chat.
Excellent.
But I'm shocked his mother thinks this is normal or
Normal. Yes. I was as well. For him, I was concerned that he had new onset psychosis, new being a loose term per se, if it's been occurring for the past year. And I'm concerned for kind of trauma. When it does get a little further, there had been some difficulty as he was walking along the streets, getting him into the police car. And so there may have been some aggressive usage to get him to the police station that may have been more traumatic in nature. As we talked to him, we reviewed some options of what's available. So as kind of discussed, he is a patient, although not registered with the VA, who has VA access. He is also eligible to be seen at Guam Bureau of Health, so kind of our management and thoughts for him. If he had no signs for trauma, we'd probably just bring him to Guam Behavioral Health for evaluation. And it's somewhat surprising, although not unusual, that the Guam Police Department did not. However, due to trauma, we had just elected to bring him to the ER instead. I'm near the Naval Hospital, and so we brought him to the Naval Hospital, which he has access to. And the Guam Naval Hospital ER is available to anyone by ambulance. So they will potentially transfer if you don't have military care, but VA patients are eligible for full inpatient and ER care at the Naval Hospital. When he was sent there, he did actually have an arm fracture that was identified. So either in his arrest or similar instance when he was walking around, he did break his arm. They splinted him. Naval Hospital Mental Health Department did evaluate him. However, as commented, they cannot do any inpatient care. And so they sent him to Guam Behavioral Health. He did, as mentioned, Guam Behavioral Health can't do long term. They have 3 or 7 day inpatient programs. He was there for a 7-day assessment and started on an antipsychotic. As mentioned in the VA, we do some case management. And so we were tracking him and following along with him to verify this. And the Guam Bureau of Health is aware that we have this option called us. And he was started on an antipsychotic, and we arranged his follow-up further from there. When I ended up seeing him again around day 8, he was actually doing quite a bit better and was very coherent at that time. So that kind of reviewed some of the interesting cases, interesting concepts of the cases that occur in Guam. I will tell you that this is not an unusual situation. It is not unusual for people to kind of be incoherent and just accepted kind of like at home for a long period of time. It is not unusual for their, in his case, there was no substances involved, but it's not unusual to have some substance abuse issues occurring in the situation. The most common of which in Guam being methamphetamines. But some things are just tolerated for a long period of time, and people come in kind of what I might think was a late stage finding. If people can't get their care here, for example, he needed care more than 7 days, what would be options for him? And what would be some ways for this? While most situations would involve us contacting Hawaii or trying to get someone there. Keep in mind, a lot of people in Guam are from the Philippines, have and lived in places like Japan, Korea, and these places are actually technically closer. And so it is not unusual then for them to just get a plane ticket if possible and fly to the Philippines for medical care. This also leads to some interesting scenarios for managing their care. And so let's kind of talk about how that might occur. So it is very expensive to do a traditional medical evacuation in Guam. The private insurance can do it. It is very expensive. It does require a hefty copay up front. I used to work at Guam Memorial Hospital, and while working there, if you had one of the private insurances, you need to be medevaced, you'd have to front around $25,000 up front prior to them flying you off, which often limits services for those people. There are some grants and some options that can be done, but challenging. Most medevacs happen for people who have military or VA service options. So knowing once again, if they can be registered for the VA, I get not infrequent phone calls from Guam Memorial Hospital or GRMC to enroll someone just to be eligible for medevac options. And Dr. Weir is correct. There are some history of issues with the Department of Corrections, with the holding cells. I did not allude to it in this specific case, but also when he came in, he was drenched. It is not uncommon for the police here to use water therapy to calm down people in jail. And so...
does that work?
No.
I wouldn't think so.
It doesn't, but
they do it.
It's something to do. Yeah. Not always the best options available. And so when he did come here, we did give him a new set of clothes just because he was too drenched. As we're trying to medevac, though, there are options to medevac to the Philippines. Not necessarily waterboarding. I mean, maybe I think waterboarding is more probably towards like interrogation. Think of this more as like a fire hose to calm you down. If you're muscly tired, you're less aggressive or less or more easily to maneuver. Anyways, so St. Luke's Hospital is a hospital in Manila. It is Medicare available, and so now one of our insurances can deliver and provide care there if you can be flown there. Some people, though, like I said, Korea is very cash business, and so people do medevac to Korea. Each of these places is roughly around a 3-hour flight, while the flight to Hawaii is an 8-hour flight from Guam. And so if you have the means, you can. The military will often medevac you to Okinawa, which is about a 3 or 4 hour flight away as well. And that's actually the medical transport, the C-130, that they will medevac you from to get you there. Keep in mind also, there are no medevac vehicles on Guam. And so each medevac has to be called in. Any point in time you do want to fly someone out via a medical evacuation option is a 24-hour lead time and then the flight. And this is what makes medical management so hard. If any of you have ever struggled getting a hospital bed at some place like I have, they often don't hold a bed for longer than 24 hours. And so it's technically impossible to hold a bed and medevac if it takes me at least 24 hours to get a plane here. So it's challenging, to say the least.
Is that Okinawa, the little plane out in the looks like middle of nowhere, East China Sea?
Exactly. South of Korea, but a little north and
I didn't realize it was that far south of Japan.
Yeah. People often think of Japan a little south of Korea, but most of Japan's north of Korea. Guam is actually more or less directly in the middle. These are actual distances. Tokyo is 2,500 kilometers. Manila is 2,569 kilometers. So kind of equidistant for some of these locations. Compared to, like I said, Oahu, which is an 8-hour flight, or a Houston away, if you will. I think Delta has a direct flight to Oahu. Because of that, the inpatient acute care stuff is very challenging. And so a lot of our medical evacuations end up being for planned admissions. Substance abuse is pretty popular. Some PTSD programs can be arranged for mental health purposes. And then in a controversial one, all active duty suicidality is medevaced in Guam. This is where it gets to be kind of an interesting care, and kind of going to one of the comments that Dr. Weir put into place. Guam Bureau of Health is not Joint Commission. And because of a mandate, you cannot send active duty military to non-Joint Commission places. And so it is seen that it's not appropriate to send them there. And so anyone who is not able to be fixed with a crisis utilization unit, who's active duty, is flown off island every time. However, due to funding or purposes, that's not true for active duty family members or VA who do use this services at Guam Behavioral Health. This is where it gets to be kind of controversial in that nature. Other considerations that happens not infrequently. We brought up the COFA nations before, the Compacts of Free Association. These are protectorate places. As mentioned with who is a U.S. citizen and who are not, these three countries are countries. They are their own rights and own privileges. However, due to being a Compact of Free Association state, they are allowed to live in Guam as permanent residents forever, and thus avail themselves of medical services here. However, it gets to the other kind of questioning legal statuses for medevacs, sometimes care, sometimes insurance, that can get sometimes tricky when trying to address with patients. As mentioned, people do live in other places like the Philippines, and will get their medical care there. And they'll come back with their prescription saying, please prescribe this medication. And that medication doesn't exist in the US. And so we have a lot of people who come from foreign places with non-FDA approved treatments that are very challenging to convert over for their general medical care. Due to limitations of people in Guam, I mentioned the kind of wait time for new people in psychology. It is very challenging for acute and new scenarios. And so some of these programs have long wait times, which are not appropriate in other places. And just so they're not forgotten, Department of Education has tons of staffing issues. So for children, for general medical care, for pediatrics, is even worse than adults. And since that's kind of a downer note, I'll leave it as a questions comment. And this is actually a picture from one of my hikes. The reason why I'm in Guam is because it's so pretty. That's actually my daughter in the middle there on a hike in a place called Ratidian. We were commenting before that Guam is a lot less visited. And so this is we were the only people walking this beach that day, which was really pretty. Questions on Guam mental health availability and some practicality of concerns.
There's a chat about the Todu Guam Foundation.
Yes, that's true. One of the newer nonprofit ones, the Todu Guam, has been doing, and they're the ones that provide the TMS out in network that we're commenting on. So that is true. And they have other things. They are one of the newer, and they've been very successful with some recruiting options lately. So yes, that is another evolving program in Guam.
So is that the only place you have the transcranial magnetic stimulation?
Correct.
So you don't have like well, if that's the only place, at least you have one place.
Exactly. And Guam is, in my opinion, a place of for people who are trying to solve problems. And so I always think to myself what the gold standard should be and what we should be doing, and then what can be done in trying to get that answer. Sometimes it can be uncomfortable for a lot of situations. And so, yes, you have to often be creative and know what's available. In my own points today, there was a quote I used to describe for people You can waste your lives drawing lines, or you can live your life crossing them. And so sometimes you have to have a yes answer along the way. Yep, and public health has also had some people in the past coming through as well. The indigenous beliefs integrated, yes. And so the Sarahanus have their own program and own people you go to. Oftentimes, they don't necessarily aren't well integrated into the Guam Behavioral Health or hospitals, but I do an annual meetup with them just to talk how they're doing. But a lot of times, because it has some connotations with them, a lot of the Sarahanus and patients aren't always quick to share that, and will sometimes you have to kind of work your way and trust with the patients to get that information. It is often something that's not stated as opposed to something that's more openly stated.
So if you could have magically one resource, what would it be?
Yes, I think probably the biggest deficit in Guam is the long-term care options for some of these patients. We struggle a lot trying to get people off island for a little bit, but I always question sometimes the success of that. When you have your off-island PTSD programs, which are evidence-based, they have excellent answers. But a big portion of that is being integrated into your own social networks and family as well. And the more that we send people off island for these care, and then they have to come back here, I question if these social aspects are being ignored. I think it was a tragedy to lose some of our long-term options that has eliminated some of our more chronic people that have our issues. And a long-term facility that is managed with some appropriate psychiatry, psychology services is the most answer, I think, here. If nothing else, just to try to address more of that the suicide situations and people just dealing with long-term psychosis.
Well, we don't have, it's not to the level of Guam, but Hawaii also has shortage of long-term care. We have a lot of Filipino care homes. I think they're especially good at it. And so that's interesting. And I would think, you're closer to the Philippines. I don't know if that's an option or if there's.
And there had been a lot of talk in the past, what is needed is a person to spearhead things. Guam is often a place one of one, and when we ask, is there a service? The answer is there is a guy doing a thing, and it would take someone to spearhead long-term care. I've been trying to discuss that with GRMC personally to try to invite people. I've been trying to work with the VA for those purposes, for my own selfish needs, but Guam itself has around 100 practicing physicians on island. I have the personal cell phone numbers, about half of them. It's small, and the people here who are working run their department and potentially only that entire field. And so it would take someone to come here. One of the difficulties of Guam is there is no continuing education for that purpose. It's just hard.
Oh, so there is a geriatrics grant, or there was. I don't know if it's ending now at the UOG. So
Yes.
continuing ed, and we do have an echo for geriatrics. So continuing ed might be a solvable problem if there were champions. And then GRMC might be willing to do training. So they have the Area Health Education Center now.
And I think they would.
Yeah.
And as Dr. Weir comments, yes, there are a few places, and we have been creative. So when Guam Behavioral Health lost a long-term care option, they teamed up with GURA, and there are a couple of those housing. There are 10 dedicated beds for that.
Wow.
But as alluded to, there are people sometimes who are stuck there for years and years, and stuck being a loose term. And
Yeah,
so
and that's the bed. The bed's full there.
that's full, and
You know,
it's a tough situation.
it amazes me there's no psychiatrist or psychologist on the hospital staff. Wow.
Um, so in the island of Guam, I think today has 5 psychiatrists working on the island, and 2 of them are employed in the VA clinic. Um, and what that's why I emphasize when I say the bigger clinics in Guam are our images in our mind is probably not the same if you've been to LA or maybe in Oahu. These are
I mean, we have
different,
shortages, but they're nowhere on the spectrum of your shortages.
right?
You know, it's like comparing us to LA, you to, I mean, it's like, yeah, it's mind-boggling. Well, this was an excellent presentation. Renata says, this is going to sound absurd, but I will ask it anyway. What is the reason preventive health isn't considered long-term care?
I love that. And as a primary care physician, I am on board 100%. And I'm with you. The comment I would make is the concern for, which is a recurrent problem and more of a potentially cultural one, is the homelessness slash near homelessness level of Guam. Guam is not as expensive as Hawaii, but probably on par with California. Guam is very family oriented, and so you have many compounds or places that are multi generational, and some people just live there in a situation that probably would not be considered a home, but is a house in sense. I've struggled with getting people generators and electricity to their lean-to on their parents' property, and that's the near homelessness. And when that person has needs that require medications to be refrigerated, or a CPAP that requires a power source, the long-term care is not available for that person. And the interesting aspect for a person not from Guam is that is somewhat considered normal. A lot of people be in this situation, and while they maybe I might consider them homeless by my definition, they would consider that a very average scenario. I have a homeless patient I see very frequently in my panel who lives in a hole on the beach. He never defines himself as homeless. He says he sleeps covered every night, and he just walks to the clinic afterwards. And so sometimes arranging things for people is challenging, and especially for a place where things didn't get mailed. All meds that aren't on island all the time gets mailed to you. If you don't have a mailing box or a PO box, you are ineligible for that.
Do you ever receive medications at the VA
Yeah,
for them?
and so in a potentially shady scenario, we have we hold medications here longer than I want to for many patients who are essentially homeless. We
Uh,
shouldn't do that, so don't tell too
yeah,
many people.
yeah. Let's see. Gerald Coffey asked, does Guam have reciprocity for licensed mental health providers in Hawaii? I heard for psychologists, there's some kind of regional pact, but not, I know psychiatrists, I don't think there's any reciprocity. Do you know?
Not easily to my knowledge. The only thing that comes up is then with the VA as a federal entity, anyone who has a medical license meets criteria for practicing here.
Sure, so you could work, so you could actually work anywhere in the US and people could work at the VA, but not outside the VA, I think.
Exactly, exactly.
Let's see, as a physician who had visiting students come in, they were often perplexed at the lengths I went to ascertain just what home living situations were like, Dr. Weir says. Yes.
And 100% right. As I mentioned, my patient says, no, I live on the beach. Now that beach house is a $1 million house. What do you mean you live on? Do you have a house? He's like, yeah, I have a roof over my head every single time. No, what do you mean you have a roof over your head? Well, it's a cave. I have like a cave I live in. Okay, that's different. Does your cave have electricity, water? Well, no, I collect water at the stream. Okay.
Renata says, so maybe we need to create Amazon PO box like refrigerator. I thought I said refrigerators, like refrigerators for people whose home is Earth.
I love that. And there are programs, and I've been in Guam too long, so I didn't know these things actually existed, the Amazon PO box stuff. And so I'm trying to team up with the postmaster here to do so. And that's where the kind of difficulties of my job is. At one point in time, I was just a family medicine physician, but I spend more time contacting public officials for help than anything else. So when I allude previously to cultural things, and I refer to talking to mayors, that includes me. I chat with mayors for rides, houses, PO boxes. One of the mayors in Alahan actually has one of my patients get mail at his house just to help out with this process. So you have to be creative here, and then you can do something. But it's tiring. I only have so much creativity in my mind each day.
Well, thank you so much. Oh, we got a new chat. I didn't realize how uninformed I have been regarding Guam. Very informative on several levels. Thank you. Yes. So this was a little heavy today. So next week we're going to learn how to meditate. So we all feel a little better. You know, we had to lighten up last week with the sex euphemisms. We learned a lot. But next week we have Martin Deleuze, who is a yoga instructor we had on last year, and he does body work and mind stuff. And so he's going to talk to us about meditation for relaxation and health next week. So that's my pitch. And yes, thank you so much. That was wonderful, Dr. McDermott. Any last
Thank
comments?
you all. I appreciate it.
Oh, thank you. The mahalos are coming in now. Sasam, how do you say thank you in Chamorro? And
Zeus Maasi.
Suis Maasi. Yes, I always get that.
Zeus Maasi. And then my response back would be Buen Probetsu. You're welcome.
For those who are interested in what being a U.S. citizen in the territories, you might want to look up my son. And, what's your son's name, Dr. Weir? Look at my son. Suis Maasi. I've never said it well. Gotta work on that.
That's pretty close.
Okay. We do have a couple medical students over at Guam Regional Medical City. So if you're interested, oh, there's a website. Okay. Good. All right. Any last questions, comments? Neil Weir. There we go. Well, thank you, everybody, and we will see you next week. All right.
Mahalo.
Bye.
Sijusmasi. Happy day, everyone.
That's how you do it. All right.
Yes.